Thanks for staying with us. Earlier, Ground Up had reported that the Department of Health was working vigorously to avoid a standoff with nurses. Some have threatened to work in their own clothes. That's if a dispute over the provision of uniforms is not resolved. It all comes after the Department of Health admitted it would miss its October 1st deadline to deliver the uniforms. The government cited reasons behind the delay to procurement issues. Let's get an update now. I'm joined by Sibongiseni Delihlazo, who's the Denosa spokesperson. A very good afternoon to you. Thank you for your time. What has resulted in this impasse? My understanding is that the allowance stopped after a new agreement was signed in the Public Health and Social Development Sectorial Bargaining Council. What has happened?
Well, thank you very much. Good afternoon to you and to the viewers at home. Well, in 2022, we entered into an agreement as Labour with the government, the Department of Health specifically, on the provision of uniform to the nurses in the country. From 2005 up until we reached this agreement last year, the nurses were receiving what you call a uniform allowance. That is for them to go and buy just one set of uniform, because prior to 2005, we're not getting any allowance. So we've been struggling. We've been pushing this for the government to really get to a point where they are able to provide uniform to the nurses. Hence, we signed this agreement last year. But the agreement obviously was stating that the 1st of October 2023 was the year that nurses would be getting their first set of uniform. And therefore, by the 1st of April, it meant that this year, nurses will no longer get the uniform allowance in favor of the various sets of uniform that they will start receiving from the 1st of October. Around May, we reflected thoroughly as Denosa in trying to really check on whether the government is really ready to meet this agreement, to make the deadline of the 1st of October. By the look of its own processes, we were not convinced that the government was willing enough and would be ready by the 1st of October to really provide the nurses with the uniform. We expressed this concern, and in expressing this concern, we set the conditions for our government, and we said if the government is not really giving the uniform to the nurses, because it will not be for the first time that the government is not meeting the deadline as per the agreement in the collective bargaining. There's been a lot of undermining of the collective bargaining agreements by the government. So we said if they do not give nurses by the 1st of October 2023 the uniform, they must consider giving them the allowance, because they were not given the allowance this year. Because it was a way of saying, how can you expect nurses to have uniform when you have not given them? As the agreement was saying, we give them the uniform by the 1st of October. So we're saying, give them the uniform by the 1st of October. If you do not, be ready to really give them the allowance. But I think to also report from towards the end of last month, towards the end of September, there were negotiations at the council. There was a sitting, and the government did come on board and was quite honest, expressing that it is not going to be able to provide the nurses with the uniform. And we set the conditions, of course, as to what we think should be happening, and that is the payment of the allowance. And up to now, I can report that the government has agreed indeed to give the nurses for this year the uniform allowance in the amount of 3,153 rand. So at least with those conditions that were set, we were really serious about it, and we're not going to budge, especially if the government is not coming to the bargaining chamber, the council, and reporting about its own processes, the tendering processes, on whether it's going to meet the deadline, because we felt it was the undermining of the collective bargaining, as it was always done on the side of the government.
So what do the conditions set mean for the next financial year?
Well, fortunately, this current financial year, on the 30th of November, if the agreement enjoys majority support, we've done our own mandate collection process as Denosa. Majority of our provinces are agreeing that we should sign the agreement. Now, if the agreement is signed by majority members in the council, it means that nurses from the 30th of November this year, they will be getting this uniform allowance. Now, this will obviously enable them to go and buy the uniform. But from next year, we have moved the provision of the full set of uniform to nurses to the 1st of September 2024. And we're hoping that the government will indeed meet its new deadline now, because the processes that it needs to embark on needed a lot of time, to allow their own internal processes like tendering processes, issuing of tender documents and tender notices and so on. So we're hoping that by come 1st of September 2024, nurses will still get the sets of uniform, because it is important to also note that with the uniform allowance that nurses are getting, it is not enough. It hardly completes the full set of one uniform. But with our agreement with the government, at least about 2-3 sets of uniforms in the first year, and the second cycle of provision of uniform will be given about 2 sets of uniforms. So at least nurses will no longer struggle and pay so much from their own pockets the money to buy uniform and quality uniform, because it is expensive out there.
As you speak about quality uniform, I understand you also had expressed concerns over the procurement process, the acquisition of the uniforms. Where are you standing with that? Are there any prerequisites that have been set out for the final tender process and the actual manufacturer who will be allocated?
Well, we understand that the government, from its side, it is still quite steadfast in wanting to really decentralize this tendering process, which is something that we're extremely concerned about as Denosa. Once you start to decentralize a tendering process, particularly on the provision of a uniform, we foresee many risks. Of course, one risk is that of corruption, and we are very concerned about the porous tendering processes in our provinces. It may happen, and this is where our concern is, it may happen that Province A and Province B may not find a service provider that provides the exact set standard of uniform. And by that, you may come to a reality that a uniform that is provided in Province A may not be the same as the uniform that is provided in Province B. The supplier in Province B may reason and say, the provider of the fabric is not able to give us this set standard, and therefore we think let's agree on this lower standard, and this is where our concern is. So we feel that this process must be centralized, and now that the date has been moved to next year, September 1, 2024, we hope that negotiations will ensue, because we still feel the need to really convince the National Department of Health to take ownership of this process and not let the provinces with a variety of experience and skills in procuring what we believe and think should be a one set of uniform for every nurse in South Africa.
I mean, do you think overall that the arrangement is sustainable? Well,
currently we are not hopeful if the process will be decentralized. But once you start to centralize a process, we feel at least it will be sustainable, because, once you negotiate on a bulk supply of uniform, and we feel that provinces will not be disadvantaged, because if Province A, B, and C have found a service provider, the service provider will only confine itself to serving provinces A, B, and C, and Province B or D, E, and F may struggle to get a supply of uniform in the quality that has been set by the agreement. And that is where our concern. We hope that by centralizing the process, you safeguard this process itself, you ensure that it is watertight in terms of corruption risks. And in provinces, a lot of money goes down the drain via corruption means, and we're concerned about that, especially with the provision of uniform. This will be a lot of money, and we are not in a position where once we reach an agreement with the government, it now opens up a new window of opportunity for corruption, something that we've been vocal about. And by centralizing the process, we believe it will also minimize the risks of corruption.
What would have happened had you not been able to reach common ground with government? I mean, what would it all have meant for nurses going to work every single day? Were they prepared to go without uniforms?
I'm afraid they don't have the uniform. Remember, they were not given the uniform allowance on the 1st of April. They get given uniform allowance on the 1st of April each year. They were not given the uniform allowance that enables them to buy uniform. And should they not have been given the uniform by the 1st of October, that obviously would mean that they do not have the uniform. And I'm afraid we make this announcement and we're quite serious about it. That because nurses do not have a uniform, they must not be expected to report for work with the tiered uniform that they have, because they last bought it last year and you only can afford to buy one set. Now, this embarrasses them because the quality of this uniform is not up to standard. It does not make them feel professional and confident about themselves and their profession, and let alone the image of their profession on the patients and also on the public. So we obviously indicated that come 1st of October, if neither uniform allowance is paid nor uniform is provided to the nurses, then nurses will report for work with their normal clothing, which is a bit of a risk because you understand uniform is very critical in nursing. It also does form part of infection control measures. Of course, because it is the nurses' career, they are serious about it, and let's respect their regulations on how they should present themselves when taking care of patients. And also, not everybody in a hospital is a patient. Therefore, it is important for nurses to know who patients are, and also because patients may not everybody in a hospital is a nurse. Patients who need the nurse's care must be able to identify a nurse and must be able to call for their attention when they need such an attention from the nurses.
Very well. Thank you so much for giving us this breakdown. Sibongiseni Delihlazo, spokesperson for Denosa, speaking about what could have been a standoff when it comes to nurses' uniforms.